Hello friends, welcome to our YouTube channel Nursing Essentials. Today we are going to learn about cystic fibrosis. And friends, it is an important condition or disease from exam point of view. So in this video we will learn in detail about cystic fibrosis, and in the end of the video we will also solve some questions regarding this disease. So let's get started. So firstly, it is a disease that passed down through families, means it is a genetic disorder, or we can say it is a congenital problem that causes thick sticky mucus buildup in the lungs, digestive tract and other areas of the body. So main thing that occurs in this disease is accumulation of mucus and or the accumulation of mucus in the lungs, digestive tracts that cause blockage in some organs. So this is the main reasons behind this disease, and the main cause of this disease is mutations in the gene. And if we talk about the which gene is affected, then the CFTR gene, that is cystic fibrosis transmembrane conductase regulator. So this is the main gene that is affected in this disease, and it is a chronic disorder of the exocrine system. So here we have to understand that it is a exocrine disorder, means exocrine glands are those glands which secretions occurs on the surface, means the secretions are not in the blood, the secretions are on the surface. For example, in the respiratory system, digestive system, pancreas, kidney, liver and reproductive organs. So in this way, it in this disease the mucus become thick and more mucus is accumulated in these organs. So this is the main reasons behind this disease. Now the glands secrete thick and sticky mucus, as we earlier discussed. Body produces thick sticky mucus, clogs the lungs, obstructed the pancreas. Sometimes the sticky mucus clogs the lungs, and if the disease occurring in pancreas, then it also affects or obstruct the pancreas, due to which malabsorption and malnutrition will occur. As we all know, pancreas helps in digestion and absorption and all the like digestive system. So if the pancreas is obstructed, then malabsorption and malnutrition will occur. If we talk about the pathophysiology or how the genetic disease is transmitted, then it is a autosomal recessive disease. Sometimes it is also asked in exam whether it is a autosomal recessive or dominant. So we have to remember that it is a autosomal recessive disease. One mutated gene from each parent means parent do not have disease, but they are carrier. As here only one gene is affected, and here also only one gene is affected. So when one chromosome will come out in children, then the child will be affected, means both the chromosome of the child will be affected. So the parents are carrier, not the diseases. The parents are not affected by disease, but they are carrier, means they are carrying one affected chromosome. So when they transmit their chromosome to their children, then the disease will occur. So in this way the disease is transmitted from parents to children. So that is why it is called a genetic disorder. So if we talk about how this disease affects our systems, then firstly, during first 2 days of life it affects newborn as meconium ileus, which is a medical emergency, and it is a multi-system disorder: digestive, respiratory and urogenital. Digestive system means meconium ileus in newborn, blocked bile duct, poor fat absorption, liver damage, means if the bile duct will be blocked, then in this way the fat absorption will be affected and liver damage will occur. If the pancreatic duct are blocked, then at that time poor digestion will occur, and sometimes it also cause pancreatic diabetes, because the beta cells will also be affected in the pancreas, then it may also lead to diabetes. Abdominal distension, as if the intestine will be blocked due to clogs in the intestine, then it also causes abdominal distension. Intestinal obstruction or intussusception is also the same thing, as the abdominal distensions also occur in intestinal obstruction or intussusception. So in this way the digestive system is affected, means either it can block bile duct or pancreatic duct or cause abdominal distension. Next we comes to respiratory system. If the mucus become thick or it will also cause chronic infection, inflammation, airway obstruction, and blocked airway. The symptoms will uh, become like chronic cough, wheezing, or sometimes may also lead to pneumonia. Next, the system that is affected is urogenital system. In urogenital system, infertility in men means the in means the man will be infertile for the whole life, because the sperms will not be transmitted, or due to the obstructions in the vasa differentia, or this in this way the infertility in man or decrease fertility in female. Urinary incontinence due to muscle weakness. So in this way digestive system, respiratory system, and urogenital systems are affected in this disease. So next we comes to diagnosis. Diagnosis: newborn screening tests are performed. IRT test, that is immunoreactive trypsinogen test. Immunoreactive trypsinogen test is also performed, in which if the level is more than 60 nanogram per ml means the test is positive. DNA testing is also occur. As we all know, this is a genetic disorder, so DNA testing may also be performed. Sweat test for chloride content. As if the chloride content is more than 60 ml millimole per liter, then we consider it a positive, and chloride content or the sweat test is a confirmatory diagnosis of cystic fibrosis. Chest radiographs, pulmonary function test, ABC analysis for the assessment of disease progression. These tests are assess the progresses of disease. If it comes to treatment, then there is no cure, but the treatment helps to manage the symptoms or increase the lifespan of a person. So in which we give anti-inflammatory, antibiotics, flu vaccine to prevent and control lung infection, and bronchodilators, mucus thinning drugs to loosen the mucus from the lungs. As we recently studied that it blocks the bronchioles, or it also blocks the respiratory system, so mucus thinners are given. Chest physiotherapy also helps to reduce symptoms. Stool softeners are given, so in order to prevent abdominal distension, intestinal distension, so stool softener laxatives are given in order to treat intestinal blockage. And supplements of pancreatic enzyme as to improve the digestion, so pancreatic enzymes are also given. Lung transplantation in case of severe lung damage. So these are the important things regarding cystic fibrosis. Now we comes to questions of this disease. So our first question is: cystic fibrosis is a genetic disorder that causes the endocrine gland to work incorrectly. So we have to find out whether this statement is true or false. We now studied that genetic disorder and it affects exocrine gland, not the endocrine gland, means this statement is false. So here our first question is: cystic fibrosis is a genetic disorder that causes the endocrine glands to work incorrectly. So here we have to find out whether this statement is right or wrong. So friends, as we studied that it is an exocrine gland, so it will not affect the endocrine system, so our statement will be false. So the answer is false. Select the systems below that are affected by the cystic fibrosis. Here we have to find out which systems are affected. Like first is reproductive, lymphatic, respiratory, GI, neuro, and integumentary. So as we know, it affects reproductive system, respiratory system, GI system, and integumentary system. Means the skin is affected, in which the sweat chloride increases. So our answer will be A, C, D, F. A respiratory, reproductive, GI, and integumentary, not lymphatic and except a neuro. So third question is: you are educating the parents of a 8-month-old who was recently diagnosed with cystic fibrosis about the disease. You explain to the parents that the child has a gene mutation on the. So our answer would be B, because as we know that it affects CFTR gene. So answer is B here. So and the fourth question is, you are providing 18 or old 18-year-old male who has cystic fibrosis. Select all the possible complications this patient can experience due to cystic fibrosis. So here we have to select all the symptoms or all the complications that a cystic fibrosis patient experience. So our first option is blood glucose level 225 mg per dl, hearing disturbance, hemoptysis, meconium ileus, greasy fall, smell, stools, excessive mucus production, coughing, infertility, and weight gain. So here, as we know, it also affect the pancreas, so blood glucose level also be elevated. So A option is right. The second, hearing disturbance, hearing is not affected in cystic fibrosis, so this is not our answer. Third is our answer because hemoptysis, as it affects the lungs, and sometimes the blood is also present in sputum. And our D is not our answer because we are talking about 18-year-old patient, and meconium ileus only occur in early days of life. So this is not our answer. E is our answer, greasy, foul smelling stool. The stool is affected in which the stool will be greasy or foul smelling. F is also our answer because excessive mucus production is the main thing in this disease. And G is coughing. The patient may also experience coughing. And H is also our answer because it is causing infertility. And I is not our answer because it doesn't cause weight gain. So our answer are A, C, E, F, G, H. Our last question is, the patient completed a SWAT test yesterday. The reports results are back and are 45 millimole per liter. As a nurse, you know this mean. Our options are, the patient tested positive for CF, the patient tested negative for CF, or the patient needs further testing because tests are not conclusive. So here our answer is C. So why the C? The rationale is the sweat test is a gold standard test for cystic fibrosis. If the results is less than 39 or equal to 39, then we consider it is a negative. But if the results are in between 40 to 59, means we need further testing. The results are not conclusive. If the results are more than 60 or 60, then we consider it is a positive test, positive result. So in this way, the answer of this question is C. The test is, the results are not conclusive. We have to further testing for confirmation. So in this way, these were the five questions. As first question's rationale is, as it is exocrine gland. Second questions is, major system are affected are respiratory, skin, genitourinary, and GI. The third answer was CFTR gene is affected. And the next fourth questions we studied about the symptoms. The hearing disturbance is uncommon in this disease. Meconium ileus occur in infants, and weight loss rather than weight gain. So in this way. And last questions was about the sweat test, that is a gold standard test, and here our questions was 45. So we have to remember that we need further testing, the tests are not confirmatory. So in this way, this is all about cystic fibrosis. So once again we are recapping. So in this as we studied that it is a genetic disorder and transmitted from one generation to another, and the main cause is CFTR gene mutation. And then we studied which systems are affected and how this disease is transmitted, as the parents are carrier and the child will be affected, autosomal recessive disease. And next we studied the systems that are affected in this disease. And next we studied about the diagnosis. The main diagnoses were sweat test, DNA testing, and newborn screening. Treatments only were for the reduction in symptoms, as it is not curable. And next we solved some questions. So friends, this is all about cystic fibrosis. Thank you for watching this video.